Mr. Guthrie and the gentleman from Texas, Mr. Green, will each control 30 minutes. The chair recognizes the gentleman from Kentucky.
Thank you, Mr. Chairman. I yield myself as much time as I may consume.
The gentleman is recognized.
I rise today in support of H.R. 1216, the health care bill that was signed into law last year, spent over $1 trillion, and empowered federal bureaucrats more than it did the American people. As a member of the Energy and Commerce Committee, I've been working on legislation that takes steps to build.
Gentleman will suspend. House will come to order. The gentleman from Kentucky is recognized.
Thank you, Mr. Chairman. To take steps to peel back a few of the many mandatory programs that were instituted in the health care law and limit the federal government's unprecedented power. Section 5508 of the health care law authorizes the Health and Human Services Secretary to award teaching health centers development grants and appropriates $230 million from 2011 through 2015. H.R. 1216 amends the Public Health Service Act to convert funding for graduate medical education and qualified teaching health centers from direct appropriations to an authorization of appropriations. This bill is not about the merits of graduate medical education or teaching health centers. Everyone agrees there is strong need for more primary care physicians in our health care system. But picking and choosing one program over another to receive automatic funding is irresponsible. Making these programs mandatory spending is unfair to all of the other health care programs that have to compete every year to continue to receive funds. For example, as HHS Secretary Kathleen Sebelius said during her testimony before the House Energy and Commerce Committee earlier this year, the President's FY 2012 budget eliminates graduate medical education for children's hospitals. While children's hospitals must go through the regular appropriations process to fight for funding, teaching health centers will receive an automatic appropriation. We are $14.3 trillion in debt, and our deficit for this year will approach $1.5 trillion. Congress is making difficult decisions about which programs to fund and which to reduce. We must prioritize, and I find it unfair that some programs are completely shielded and do not have to prove their merit to earn continued funding. Urge my colleagues to vote yes and reserve the balance of my time.
The gentleman reserves. The House will come to order. The committee will come to order. The committee will come to order.